primacy of life, the pursuit of health. This is, in fact, a religious commandment in the Jewish tradition, not to forget that our toast is l'chaim, to life, right? So let me wish all of you a l'chaim as we begin. And this is based on the Torah teaching that we are supposed to choose life. Uvacharta b'chayim. And according to the tradition, the mitzvot are all given that we may chai bachem, that we may live through them. And all the commandments, especially the ritual commandments, may be abrogated, overruled in order to preserve a life. There are only three very important ethical commandments that would stand above that. The basic concept that we're affirming here is pikuach nefesh. The Jewish tradition teaches us that the preservation, the enhancement, the care of life is a religious concern. So tonight we are here with one of the distinguished representatives of the medical profession to help us explore an issue that is obviously of concern to all of us. Dr. Aaron Carroll is Regenstrief Foundation Professor, Associate Dean for Research Mentoring, and Professor of Pediatrics at Indiana University School of Medicine. His research interests include the use of information technology in healthcare, decision analysis and cost-effectiveness analysis, and health policy and professionals. He is often consulted as a medical specialist in the national media. We get to have him as a member of our congregation. He's an author of academic and popular works about medicine and science. His books, Don't Swallow Your Gum and The Bad Food Bible, How and Why to Eat Sinfully, have been on the New York Times bestseller list. So Dr. Carroll and his wife Amy, who is sitting right there with him, along with their children, Jacob, Noah, and Sydney, are dear and engaged members of our congregation. And he has agreed to spend some time with us this evening to help us as a congregation better understand what is it that we are dealing with at this time. So let me begin very simply by asking you, Aaron, if you could give us a basic explanation of what coronavirus is medically, scientifically.
Sure. So coronaviruses are a set of viruses that usually cause breathing problems, respiratory illnesses. Most of them that stick around for the most part are common cold ones. They're like 4 that really exist in the human population in the long term, meaning that they're always around. They're mild. We don't notice them. In the last 20 years, 2 other coronaviruses have come out, usually from animals, into the human population and caused significant issues. The first was SARS. That came out of China and was more lethal than what we're seeing right now. It was more dangerous, but it was not as infective. And we were able to contain it. It it made it out of China a bit, but not very far, and we actually got rid of it. So it is no longer in the human population. Once in a while, it'll come out of an animal, but still we're pretty good about containing it. The second is called MERS. That's a Middle Eastern respiratory virus. That is also a coronavirus. It is also more lethal than what we're seeing now, but not as infectious. And it also has been contained for the most part in the Middle East. It sometimes comes up a bit, but we really have been able to keep it down. The problem with this new coronavirus, which is, depending on what you call it, it's also another SARS, but we're calling it COVID-19. The problem is that we have not seen a virus that is this dangerous and this infectious since what is otherwise known as Spanish flu from 1917, 1918. It is the most dangerous infectious virus we've seen in 100 years. People who are likening it to the flu are misrepresenting the idea that it is much more contagious than the flu, and in some ways actually more dangerous. But it's the infectivity that's the real problem. Flu, an average person who gets the flu might infect 1 to 1.5 people. And that's bad, but this virus will infect between 2 and 3 people. Now, a terrible virus is measles. Measles, you could walk into a room, cough, leave the room. 3 hours later, somebody could come into the room, just breathe the air, they're going to get measles. It has like an infectivity of like 14. So each person that gets measles is likely to infect 14 other people. That's horrific. But we have a vaccine, and for the most part, we can keep it contained even when it breaks out once in a while. But this, we have nothing. We have not seen a virus for which we have no treatment, no therapy, no nothing, literally in 100 years. So even when we see flu outbreaks, the flu pandemics in the last 10 or 15 years, we have some natural immunity to it because we've seen flus before. And the vaccines that we have work partially, and we can create new ones. We know how to do that. And so we were able to react to swine flu and H1N1 and other flu pandemics that we've seen in ways that we're not yet able to react to this. So this is a real problem that we have to take incredibly seriously. And, you know, the government, for the most part, in the world are responding to the threat, but almost not adequately enough. The potential danger that's coming down the pike, not to panic people, but the potential danger that's coming down the pike is real. And if we don't take real action, this could result in serious numbers of people getting ill, being hospitalized, and deaths. The numbers with, you know, no intervention are horrific. We are taking intervention, which is good, but I'm still seeing on the news today, you know, politicians and other people in charge are already starting to waver and wonder if, you know, the cure, meaning the social distancing, is worse than the disease. It is not. The disease is way worse than the cure. The disease is horrific, and we have to take this seriously, and we have to act.
Thank you. Hence the importance of social distancing. Could you explain a little bit more of why that works and how that works? We've heard a lot the expressions containment and mitigation. What does all this mean pragmatically?
Sure.
And you began talking about the this afternoon's late press interview with the leadership, positing an optimistic outlook and talking about an old malaria medication that I understand from my very simple reading of medical science is not proven to be effective and might even be counterproductive.
So let's start with strategies to counteract this. When you're talking about an outbreak, there are two main strategies you can pick. They're called mitigation and suppression. So mitigation is, so here's the biggest problem we have with outbreaks is that if the number of infectivity, what we call R0, that's the numbers I was saying before, like 2 to 3. How many people each person could infect? The problem with an R0 of 2 to 3, and what we're seeing with this virus in most countries, is that we get about a doubling of cases every 3 days, sometimes 2 days, but a doubling. And that means that very quickly we can go from we're on top of this to it has absolutely overwhelmed the healthcare system. We only have so many hospital beds. We only have so many intensive care unit beds. We only have so many ventilators. We only have so many physicians, nurse practitioners, nurses, respiratory therapists. There are only so many. And US hospitals don't work in general by keeping those beds open and waiting. They're already full with sick people. So our capacity to care for numbers in an outbreak can look good right up until the next doubling. And then all of a sudden we're overwhelmed. And because symptoms only show up every 5 to 14 days after you've been infected, we could get 2 to 3 to 4 doublings before we can do anything, because those infections are baked into the cake. What you're seeing in Italy right now is they have surpassed their capacity. You're seeing it in Spain now too. There are more sick people than there are resources to care for them. New York is this close. And when I say this close, it's not that they don't have capacity, it's that we know there could be a doubling in 2 days and another doubling in 2 days. So within a week, they could be overrun. What we try to do with mitigation is reduce that number of infectivity from, let's say, 2 to 3, let's say 2.5, just for a number. We're trying to reduce that lower so that instead of getting 2.5, it's 1.5 or 1.2. We're just trying to slow the rate of infection so that the number, it takes longer for those numbers to double. It stretches out how many people are sick at the same time so that we don't overwhelm the healthcare system. Mitigation will never, ever contain the infection, but it can slow it down to where we can start to get ahead. Suppression, on the other hand, is let's get R naught less than 1. If we can get that so that each person infects fewer than 1 other people, we actually start to see a decrease. China, South Korea, Singapore, they're doing suppression. They are all out trying to reduce the number of people who are infecting other people to the point where they are lessening and lessening, so fewer and fewer people every day are actually infected. We're not doing that. We're doing mitigation. Why is it mitigation? Because even when we social distance, which is putting people in their homes and trying to keep them away from other people, which will slow the spread of the virus, it won't suppress it. Because I live with Amy and Jacob and Noah in Sydney, and if I were infected, it's very likely I'm going to give it to at least one of them. So we will continue to infect people with social distancing, but over time, it will stop. And then we might be able to get to suppression. Of course, that'll take a long period of time, because if it takes 5 to 14 days for everybody to get infected, we could be doing this for a long time and still see increases even if we're slowing it down. So our goal is to get to suppression. How do we get to suppression? Well, first we got to slow this thing down, which is what we're doing right now with social distancing. But the second thing we need to do, and I just wrote an article on this today, it was in the Atlantic, is we got to just start doing massive testing. We have to do that so we can identify who is infected and who is not, even people who are not sick, so that we can then targeted isolation of those people and start to ease restrictions on other people. We can't do that, though, without massive widespread testing. We are nowhere near that today. And because of that, we have to maintain this significant social distancing until we can start to do that and get a handle on who we can start to ease up on and who we need to really keep this going for. And we're just not there yet.
So could you clarify whether flattening the curve would mean less cases overall or over time?
So flattening the curve will not lessen the number of cases overall. With a flattened curve and no eventual vaccine, we'll still see eventually somewhere between 40 and 70% of the population infected until we get herd immunity. That's terrible. Don't get me wrong, terrible. But it would still be better than having all of that happen within the next 6 months, in which case, predictions are dire. Imperial College in Europe did a analysis for the UK and the United States on what would happen if we did nothing. If we just let this run its course to try to achieve herd immunity, let it infect as many people as we need to, burn through the population till we get to 40 to 70% of people who are, immune because they've had it, and then see what would happen. If we do that, if we let it run its course, which I should say up front because I'm going to say numbers which are going to horrify you. No one is doing. We're not doing that. But if we just let this burn through, we could expect probably just over 2 million people in the United States to die. And because it would happen so fast, on the worst day that would peak in June, we could expect on that day about 55,000 people to die in the United States of coronavirus. That does not include how many people would die because the hospitals are so overwhelmed that we can't care for them for something other than coronavirus. That's just coronavirus's deaths. But I promise you, if the hospitals are so full that 55,000 people are dying in one day of coronavirus, we will be taking care of nothing else in the United States. And so it'd be horrific. But we're not doing that. The goal is to stretch it out, buy us enough time, and eventually we can make a vaccine, not have this issue. Because if we can buy time, eventually we'll get to a vaccine.
We're having a little bit of
mic
problem with a mic or something.
So if we never find a vaccine, it doesn't matter how much we stretch out that curve. Eventually, half the population of the world is going to get this.
So what are the best prospects for treatment and for cure?
We have almost no cures for viruses. This is what the problem is. It's like we can treat bacteria really well. We don't have cures for viruses. There's a couple of viruses which we can help people get over faster because we have antiviral medications, but those are rare. And we're trying to throw everything we can at this, not to prevent people from getting it, but to prevent death. That's where you're seeing people talking about HIV drugs, malaria drugs, other antivirals. I don't have Zithromax antibiotic, but they're trying even, drugs which are used to treat autoimmune diseases. These are fishing expeditions.
Right.
We don't have solid evidence that they work. It's anecdotal, and we should try, don't get me wrong, do the trials, see if they work. But our best bet by far is going to be stretching this thing out as long as possible and getting to a vaccine. And there's reason to be optimistic about a vaccine. This does not appear to be an incredibly difficult virus to try to build a vaccine against. Flu. One of the reasons we have trouble with flu and the reason you have to get vaccinated every year is flu is amazingly good at mutating its proteins in such a way that we have to actually change the vaccine because it develops the skill to evade our immune system. Coronaviruses don't really do that yet. And even the subtle mutations that they've seen so far in this coronavirus have not been in such a way that we think that it's going to make it especially difficult to make a vaccine. So there's reason to have hope that, a year, 18 months from now, we could have a vaccine, but it takes that amount of time to generate one and to test it and to make sure that it works and it's safe and everything else. And in that time period, we're still going to have to do everything we can to stretch out that curve and prevent the system from getting overloaded.
Let me ask you a preventive medicine question, given that this is going to consume so much of the time and of the space and of the energies of the medical profession. What should the general citizen be doing preventively to stay overall as healthy as possible during this time of confinement? And what signals should trigger reaching out to one's physician or seeking medical care?
So it's going to sound trite, but the best thing by far, hand washing. Soap and water will kill this thing. It just will. And unfortunately, hand washing is the single best thing we can do. I can't stress it enough. Wash your hands, use soap and water. 20 seconds is the recommended time for washing. Do it. This virus is transmitted not only just by coughing in your hand or breathing. It's also transmitted fecal oral, which means that when you go to the bathroom or just without realizing it, you get it on your hands. If you don't keep washing your hands, that's the number one way you'll transmit it to somebody else. Second thing, don't cough on people. Cough in your elbow, don't cough in your hand, because of course then it's on your hand, which is what we're trying to avoid. If you're sick, stay away from other people. If you see sick people, stay away from them. And don't touch your face. It's hard. And I keep having to adjust my glasses, so I sometimes touch my glasses, but as much as you can, don't touch your face, because taking it from here to there is the way that we get this. So that set of rules, it's by far the best thing that we can do. It also happens to be the way to prevent almost all other viral transmission, so you get so many benefits from doing those things. Having said that, this is more infectious than most, so the social distancing is what helps, not being around other people, not exposing yourself to other people, especially since we believe a decent number of people are carrying this and not symptomatic. They do not know they're sick. And so Rand Paul got tested on Friday, did all the stuff over the weekend, went to the gym, went to the pool, found out on Monday afternoon he's positive. All the things he was doing without knowing he was sick potentially were exposing other people. Lots of people are walking around like that right now. They don't know they're sick. They don't know they're infected. A lot of them are kids. And that's a problem because we could still be transmitting the virus. That's why we need the social distancing. So it's unfortunately the non-medical, non-technical things which are going to be the most helpful right now, but they're hard to do. And they're really hard behaviors to adopt, but we got to do them. I mean, this is just, I am not a panic guy. If you read my work in general, I'm the guy that tells you not to worry, not to overestimate risk, that the vast majority of things that people tell you to worry about are not that big a deal. This is not that time. This is a very big deal.
So thanks for your straightforward talk. One final question, and then I'll open it up in case people who are with us have some questions they'd like to raise. We've heard some people say that come summer, this will change by virtue of the change in weather itself. What is your sense there? Because this is also happening in countries with warmer climes, to the best of my knowledge.
So if this follows the course of other coronaviruses, it is possible that come the summer, we will see a slowdown, which is great. Do not get me wrong. Seasonal viruses are seasonal for a reason. They usually peak in fall to winter to spring, and then they go away in the summer. This may happen. It might not, but it may happen. The problem is that if it does and we relax, when it comes back in the fall, it'll come back with a vengeance. Because right now, this did not become a problem in the United States until February or March. And we're panicking now, right now. If this starts in September, by the time we get to like November, all hell will break loose. The best example I can give is, again, Spanish flu, 1918. It hit really badly in 1918, in the spring. People were dying. Lots of people were concerned. Everybody panicked. Lots of people died. In the summer, it went away, and we all relaxed, and everything got comfy. Then it came back in the fall, and in November of 1918, something like 40 to 50 million people died. It was almost all the deaths of Spanish flu happened in November after the spring badness. That's the panic of right now, is that whatever we're feeling right now is going to be bad, and we'll get through it, and we can get to the summer, but we cannot relax because the fall could be way worse, and we got to really be prepared in order to handle that in the right way. One, to avoid that outcome, and two, so that we don't spend the entire winter in lockdown like we're experiencing right now. We've got to be smarter about this.
Okay. I'm seeing some questions that are popping up, and I can't read them all. Can you read them, Jackie?
Or people could just probably chime in.
Yeah, we're open. One at a time. Just indicate that you want to ask a question, and if I see you, okay, the Mowers are raising their hands there. Jackie, could you unmute the Mowers?
Oh, they can do it.
Yep.
Okay.
And Jackie's asked that you use the chat box for questions also. That's on the side panel there. My question to you is this here. Why do you think that we won't be able to get the virus a second time? Do we know that we'll build up human immunity to this? Or are we just presuming that we will, or hoping that we will?
So we haven't really run like controlled trials yet, but the rate of infection and what we're seeing in other countries leads us to believe that people are gaining immunity, in the sense that we're not seeing people get infected more than once. If people were not building up immunity, then this would actually be flying up on an even tighter line than we're seeing right now, because what we're seeing is people get sick and they don't come back to the hospital. They don't get sick again. They get sort of sick once and then they seem to be immune. That would also follow the usual course of other coronaviruses. So we have all the data that we have till now supports the hypothesis that we'll be immune. That doesn't mean it's 100% correct, and that doesn't mean it couldn't mutate to get around that. But that's what we've got at the moment, which gives us at least some breathing room, but not as much as we think. Because again, almost no one in the world right now is immune to this virus. Maybe a couple 100,000 people out of the 7 billion have had it. So the vast majority of people are not immune. And so that's not really the going concern right now. It's that we have to slow this down regardless of all of that.
There's a question, what is your opinion on taking NSAIDs for symptoms of COVID-19?
Okay, so we're talking about NSAIDs, which is like Advil and ibuprofen, because there's a lot of anecdotal stories out there of people having, one, bad outcomes if they've taken ibuprofen or Advil, and two, research that shows that it's not safe. So all of the research, real research that has to do with taking ibuprofen and respiratory viruses has nothing to do with COVID, this coronavirus. There have been studies in the last 5-10 years which have shown associations between people that take NSAIDs, for respiratory illnesses, and slightly worse outcomes. almost all of it is just correlations, not randomized controlled trials. There was a good randomized controlled trial in like 2013, which actually randomized people to take either NSAID or Tylenol basically, or get steam, and it showed almost no difference. So the actual evidence we have is equivocal. Like, we're not sure about whether taking ibuprofen really is damaging and might hurt you. None of the evidence has to do with this coronavirus infection. Everything you've read about, like a doctor said, or, oh my God, in France, or so, is one, a lot of them are myth. They're not true. And two, anecdotal evidence. So this is the take-home message. If you ask me, I'm taking ibuprofen still, because ibuprofen works a little bit better than Tylenol for pain, fever, and for inflammation. But if you don't want to take ibuprofen, fine. But what you shouldn't do is panic that you've taken ibuprofen and therefore you're at real risk for a problem. There's no evidence for that whatsoever. So take it if you want. Don't take it if that makes you feel better. But the evidence for this and the real knowledge that we have with respect to NSAIDs and coronavirus is almost non-existent.
Thank you. Dan Resnick is asking, are masks effective in preventing the spread? If we have to go out to the grocery or to get gas, should we be wearing a mask?
Okay, this is when you're going to see me get a little bit passionate. I'm going to apologize ahead of time. So there's very little evidence. No, first of all, like, let's own, if you wear a mask, it probably stops some number of virus particles. Fine. But there's almost no evidence that in the community, wearing a mask will prevent a healthy person from getting sick. There just isn't. There's some evidence that wearing a mask will prevent a sick person from coughing and transmitting the virus to someone else. But for God's sake, if you're sick, don't leave the house. Like, don't be walking around wearing a mask. Don't leave the house. That's the whole point of social distancing. But the bigger point here is that masks have a very specific purpose, and they're to protect people who are on the front lines. They're to protect the people who are in hospitals, the doctors, the nurses, the respiratory therapists. That's who needs the masks. They're to prevent them in high-risk situations who are being coughed on constantly, where the virus might be aerosolized because they're dealing with very sick people. They're the ones who need masks. And right now in the United States, there's a massive shortage of personal protective equipment for frontline people in hospitals. They can't get it. I know the people who are like running the campaigns, who are on the news every night, begging people to donate the equipment. So if you've got masks, please donate them. Donate them to the hospitals and to the people who are caring for people, because that's who needs them. And they don't have them. And then, I mean, granted, we're not where we are in Indiana, where they are in New York right now, but in New York, they're like a week away maybe from none. And then all hell's going to break loose, because if the frontline people start getting sick, then there's no one left to care for us when we actually get sick. So we know that shortages are coming. We know that people are going to be hit in the hospitals. We know that there's already, national shortages of this equipment. There's a zero benefit almost, or infinitesimal, for a healthy person walking around wearing a regular mask. A slight benefit for sick people, protecting other people. But again, you shouldn't be leaving the house anyway. And there's a massive benefit for the frontline people who are, putting themselves at risk to care for us. So if you've got a mask, go donate it.
Thank you. Question from Lori, and what can we do to support the PPE needs of HCPs here in our area?
Donate the masks. If you've got equipment, that's exactly what you should be doing. Donate it. I mean, you're seeing on the news.
Talking about the regular little attached to your ear.
Whatever you've got. I mean, literally, like, they're talking at this point about how to turn bandanas and scarves into anything. Whatever you've got.
Here's my question, though. My question is, are there organizations that we can donate to? I saw something come across my Facebook today about Joanne Fabrics handing out kits for people who sew. I mean, what are things that we I'm a retired PA, and I've been on those lines, and I get it, and I feel absolutely helpless.
Yeah. So, I mean, there's organizations which are putting out instructions on how people can make sort of makeshift masks. And let's understand that there's two levels of masks. There's what we call like N95 respirators, which are like top of the line. Like they're not made of fabric. They're like, micron holes. So it's like they'll stop almost anything. We can't make those at home, but we can still make masks, which might be still better than nothing. So there are websites, and I can't remember them off the top of my head, but Dennis, if you remind me later, I'll send them to you. There are organizations which are being set up to literally answer these questions, to tell you what you can make at home, to tell you how you can donate, to tell you what you can do, because this is such a big thing for people who are on the front lines, which I'll just own is not me. But people on the front lines that need this stuff, there are things we can do, and it's the kind of thing I'm happy to give Dennis later, and we can distribute to people that they can look up.
So perhaps we should celebrate a belated Purim and dig out our masks and find good usage for them.
Sure.
David, we have several Davids, so I don't know which one is asking this. After watching President Trump's press conference this evening, I am filled with dread.
Yeah.
It seems that he is finished with science and will seek to reduce distancing. Will the medical and scientific community continue the suppression efforts, irrespective of the CDC and the White House?
So I try very hard not to be political, and I try very hard not to sort of rail against individuals. But
I'm reading the question as it is posed.
right. No. I'm just saying when I answer this, I'm going to answer it broadly. So I literally wrote an article today because I expected this. Just looking at tweets last night, politicians are starting to waver. They're getting anxious. They're hearing from bankers and other individuals. I mean, I say banker because Lloyd Blankfein, tweeted something out today. But it's people saying like maybe this is too much, and that what the damage we're doing to the economy is worse than the damage that would occur to humanity. And so without railing against individuals, that's utterly ridiculous. Let's just talk the economy first. What we're seeing in the economy right now is horrific, terrible, nightmare. We're looking at unemployment worse than the Great Depression. But if there's anyone that thinks that if tomorrow we let everyone go back to work and in like a couple weeks we get to the curve of what we saw in the Imperial College report where tens of thousands of people are dying, if people think that at that point we'll be going to restaurants and boarding planes, they're not thinking rationally. We will have a destroyed economy, whether we do this preventatively or we let the world go on fire. Both of them are going to result in a terrible economy. The difference is, in one scenario, 2.2 million people will die, at least. And in the other scenario, far, far, far fewer. And in this scenario, many more will have lung damage for the rest of their lives. And in this scenario, far, far, far fewer. The social distancing that we're doing is terrible for mental health, for the economy, for personal happiness and satisfaction. It is hard to do. It is no fun. It's difficult. It is everything that everyone says it is, and yet it is the only tool we've got in the toolbox to slow the spread of this. We're not alone in this. This is what every other country is doing because it's the only tool we've got. No one's lessening in Europe. No one is suggesting go back to work. They're clamping. There are more people in the United States that have this virus now than pretty much every other European country that exists. And that's only the confirmed cases we have. It's likely way more people are infected right now. There's no one alive who can believe right now that 1 week from today, things are going to look better than they do right now. Look at New York, look at Florida, look at Washington, pick a city, it doesn't matter. 1 week from today, it's going to look 2 to 3 times as worse because we're doubling every 2 to 3 days. So the idea that at 15 days, which should be next week, we could somehow think this is over ignores all the evidence that exists. It's just not going to happen. We have, not only that, we're not taking this seriously enough. You look at Florida, there are people like, as of this week reveling in spring break on the beach. Then they're going to board planes and they're going to fly home and they're going to take whatever they just spread back to their homes. In Disney World last week, and I love Disney World, for those who know me, on Saturday night, the night before they closed, They had the final fireworks. You saw pictures of it. There were like tens of thousands of people jammed in like sardines, passing that virus up and back. And then all those people got on planes and they brought it back. That was only a week ago. There have already been documented cases of people that have died in California from the virus they likely got at Disney World that night. We're not clamping down yet. We're still haphazardly applying social distancing. Now, many people on this call are likely doing it. That's great, but the country is not. The country still has tons of people who are not yet respecting social distancing. So we've not yet achieved the benefit. A week from now, it's going to look way worse. And if we start to think that that's when we could lessen this, we will absolutely see chaos. And I don't think it's going to happen, because I do believe that there'll be enough evidence that this is working, that it will likely overtake whatever the administration is proposing and thinking they will be able to do. Because President Trump is hopeful. He really is. He really does seem to want to believe that a week from now we'll have a drug treatment, or it'll look better, or the economy will be so bad that we will panic. But the economy is already in shambles, and it's going to look 2 to 3 times worse. And I'm not confident those drugs are going to work in any way that'll move the needle at all. And so we are in this for the long haul at the moment. Now, that doesn't mean we have to be in this forever. With widespread, ubiquitous testing, we could come out of this like South Korea has. We could do that. But it requires massive testing. I mean, the ability to test people not only who are sick, but who have no symptoms at all, so that we can really figure out which communities are being hard hit and which are not. Then we could target loosening it. It would allow us to say, hey, this family, even though you're not all fine, there's virus in there, you stay locked down, but this other family, go about your business. It would allow us to keep checking who is sick and who is not, who is infected and who is not, in ways that we could have more targeted isolation and less overall social distancing, but we're not there yet. We
Yes,
are not even close to that in testing yet.
A very practical question that many people may be asking themselves. People go and take a walk with a neighbor in the neighborhood. Can you then invite that neighbor over for dinner at your house?
No, not yet. Walking with your neighbor more than 6 feet apart is fine. Now, of course, if they're sick, don't do it. But if they're fine, sure, go ahead. Well, so Amy's behind me saying, how do you know they're fine? If they're not coughing on you, then it is unlikely that in 6 feet they're actually going to expel the virus onto you. Like, it takes force to get it 6 feet away. So even if someone is sick and coughing, don't go anywhere near them. But if they're not coughing, just by breathing, we're not expelling this, we believe, 6 feet or more. So you can walk, be outside, talk to people from a distance, be in a car, not with them, but be in a car, drive to their house, sit outside far away, fine. With distance, it is not so scary. But bringing them into the house and eating, no, wouldn't do it yet. Now, at some point, again, with testing, when we can start assuring ourselves that I am not symptomatic and I have no virus, and you are not symptomatic and you have no virus because we've been tested, then we can start to relax things. That's how we can someday get back to normal. But we're not there. And without being there, we can't even start to talk about, relaxing what we're doing right now.
You, given what you've said about South Korea and the slowing of number of cases in China, have these societies achieved immunity?
So not immunity, but South Korea. So it's important to remember that Asia's had practice with this because they've been through SARS. So everything that China that they did with this virus is they were able to do because they did it with SARS. So China, the way China worked in Wuhan and everywhere else is that they are constantly checking people's temperature and screening them. The second you are possibly sick, they literally whisk you away to a testing facility, where you're locked down, away from your family. They give you a CAT scan. If the CAT scan is negative, go home. If the CAT scan's positive, the ground glass appearance, then you might have virus. They start giving you other tests. And while you wait for those tests, you sit in a room where everyone is spaced out 6 feet apart. No one's allowed to like interact with each other, and you wait for the results. And again, if you're negative, go home. If you're positive, they take you to special housing apart from your family, where you then spend the time until you are over the virus. And it's nice in the sense that like they have dance classes and they try to get people up and moving, and it's not like you're locked in jail, but it is isolation. That's what China did. We're not prepared to do that at all. South Korea went a different tack. South Korea is literally testing like crazy. South Korea does like more tests in a day than we've been able to do in a month. They are just drive-through testing everyone who possibly want to be testing, so that 4% of the people that get tested in South Korea turn out to be positive. In the United States, something like 20-some% of people, because we're only testing the people we think have it. They're testing everybody. Because of that, they know 96% of people who get tested don't have the virus. They're more free to go about their business. We're not doing that. So we can't. We could if we ramp up testing enough so that 96% of people are getting tested are negative, then they can go about their business. But that will take massive ramping up of this. And at this moment, the government does not, and I say government meaning the federal government, does not appear committed to marshaling the resources necessary to make that happen.
Thanks to Deetra for her sweet comments about this and similar programs that the congregation is sharing with our members. Thank you for your being part of it. A question for Marcia Goldstone. Please comment further on the theory that we should be having people who have had the virus and recovered from it resume their public lives so that we can mitigate some of the economic issues. You made some mention of this, but did not elaborate.
So at this point, I think if you go to the Johns Hopkins website, which is tracking the virus in the United States, of the 40,000 people who've been infected, a couple hundred are deemed recovered. So there's a couple hundred people in the United States that would qualify for what you just said, meaning they had the virus, recovered, and can go about their business. A couple hundred people will make no difference to the United States economy. We have to get to the point where, if we're going that route, a significant percentage of the United States has had it and recovered, which will of course mean millions of deaths. So we don't want to go that route. So it's not a real viable call for us to get there. Even in the countries where tons of people have been infected, not great percentages are deemed entirely recovered yet, because it takes a long time till you stop shedding the virus and have gotten better, and people are like, you're safe to go about your business. Like I said, a couple hundred people in the United States are maybe, in fact, I'm going to go look while I talk to you. I'm just going to look it up right now. I'll give you the exact number of people in the United States who qualify in that way. I'm just going to wait for it to load. I click the button. Oh geez. Whoops, let me get the US. Okay, 0 people in the United States qualify so far. I take it back, not a couple hundred, 0. 0 people have been deemed fully recovered from the virus that have been known infected, have recovered so far. On the other hand, let's take Italy. So in Italy, of the 64,000 people who are known to be infected, about 6,000 have died and about 7,000 have recovered, meaning that in Italy, which is ahead of us, 7,000 people would qualify under the guidelines you just said. In the United States, as far as we know, 0 people have actually met that criteria yet. So it's not a viable way to go forward.
How long does it take to recover?
So to say recovered, you have to have 2 tests that have shown you're shedding no virus. We don't have enough tests. This is probably why we say 0. We don't have enough tests to test the people who are sick, let alone test the people who are not sick, let alone use tests to keep testing people who have become sick. So we don't know. It could be that people have recovered. We just can't quantify it because we don't have enough tests. We don't have that capacity yet. We're just not there.
Jason Organ is asking, how do the latest models look for Indianapolis? How many do we expect will become infected here? How many are projected to die?
So there's a good website that's tracking it state by state, and Indiana is luckily behind other states like New York, Florida, Washington, in the sense that we're not in crisis where they are, but our curve looks exactly the same. The rate at which we are increasing is following that almost exact same curve. So we're not there, but we're on our way. Now, to Indiana's credit, and I credit Governor Holcomb for this, you know, they're taking action before we get to New York, before we get to Florida, before we get to Washington. You know, I think if you haven't heard yet, an announcement has gone in place that at, I think, midnight tomorrow night, we go to shelter in place, which means that Indiana will basically be locked down. That the only reason to leave the house will be to go to the pharmacy, to go to the grocery, or to go to get medical care. Otherwise, you should be in your house. There will be no businesses operating theoretically, no other things going on. It is shelter in place lockdown. And we're doing it before we get to New York. The downside of all of this is that, as I said before, it takes up to 2 weeks for cases to show up. So all the infections that we still might see in the next 10 days or so are already baked into the cake. They've already happened, and they will continue to happen even in households. So the doubling and the doubling and the doubling can't be stopped, even with the action that we're taking in Indiana. So the question will be, after 3 doublings and perhaps another 1 or 2, even if we slow things down, what will we look like? Probably still won't be good, in the sense that our hospital systems, if you know a critical care doc or an ICU doc, just ask them, and they'll tell you they're already panicked and slammed, that they're incredibly busy, that they're suited up every night, that all the cases keep coming in, that they feel like they're being overloaded already. We're not to where Spain is, where they're literally deciding who gets the respirator and who doesn't, or who gets a ventilator and who doesn't. But with 4 or 5 doublings, we could be, but I'm hopeful that we're still getting ahead of this before other cities and states that are looking worse off. So we're doing a better job.
Related to that comes from the Seagulls about whether machines for sleep apnea with supplemental oxygen could be used by the medical community to free up ventilators.
Great question. I have CPAP. I use one, and it's phenomenal. But no, a CPAP machine will not breathe for you. It will keep your airway open while you breathe for yourself, but a ventilator is breathing for you. And beyond ventilators, some people get put on what we call ECMO, which is when a machine is basically, we're not even breathing for you. We're literally oxygenating your blood in a machine over here and putting that oxygenated blood back into you. We can't do that with home devices. Now, there are ventilators that are not being used as ventilators right now that might be good, like ones that we use for animals might be repurposed, ones which are out of date, don't meet technical FDA guidelines, but are in warehouses, but are still probably good enough, could be repurposed. And so there's a little bit of slack in the supply of machines that could still help people to breathe. But unfortunately, the home equipment that we're using all the time, like CPAP machines, just won't do it.
Well, I wanted to wrap this up by 8:30, but we have a lot of questions coming in. You're good?
I'm been going all day.
Okay, we'll talk a little bit longer, and when time comes, we'll wrap it up. A question from somebody I know. I think the last name is Harold. Debbie is asking you, if testing does not dramatically increase, what is a realistic estimate of how long social distancing will need to go on? And is there a reason to be optimistic that testing will increase here soon?
Yes. So first of all, look, we are fully capable of doing the testing. We are richer, more resourced, more technologically advanced than almost any country in the world. If they can do it, we can do it. We just have not yet had the will. Without testing, then we're really in a bind, because we can't release until we have hard, concrete data that this is getting much, much better. We will not have data that look like that for weeks to months, because that is just how this works. Because again, 14 days baked in the cake, will still be transmitting amongst family members after that. People will get weak. They will not keep following the rules. And when that occurs, that'll just extend the problems. And so without good testing, I'd say we'd be well into the summer before things start to look better and we have a sense that we could really comfortably start to loosen restrictions. But again, come the fall, all hell will break loose. We have no choice. We have to have that testing. It's not optional, which is why every time I see a government official say it's coming soon, I just want to ban that word from all press conferences. Soon should no longer be acceptable. It has to be a date, accountability. When will we have the testing? What are we doing to get it? South Korea can do it. China can do it. Why can't we do it? Like, this is ridiculous. We have to have that kind of capability. We can make that happen. We can. It's a test almost any, it's what we call a PCR. It's just testing DNA against DNA. We know how to do this. We just got to find safe ways to ramp it up. It's doable. So it's not an option. It has to be done.
What can the public do to make this happen?
Call your representative. Call your senator. Tell them, like, mission critical. This is what should be happening. Tell them, and again, I try very hard not to be political, but the president has a bully pulpit and he's not yet thrown his marker down that this is mission critical, has to happen. I don't care what it means. Just do it. Just do it. So whatever we can do to put weight on government officials, Democrat or Republican, I couldn't care less. This has got to happen.
How long after recovering from the virus will one test negative because the dead virus is still in your body?
So the dead virus is there, but it's like, but they're actually, it'll get cleared. So it takes time. And, that's why we don't have a lot of people who are recovered, because we got to get to that point where they're not shedding virus anymore. That can last a long time. There's some concern. There's a recent study about kids that, especially little kids, that virus can be shed for a long time, which is the nightmare scenario for daycares. Because, if a child gets infected and goes to a daycare and they're changing his diaper once or twice a day and they are shedding virus for, say, a month, everyone's going to get infected. It just is going to happen. So getting people cleared is a real thing. And we just don't have the capacity for checking yet. So our better bet is like massive isolation for people who are infected, and then an easing of people who are not. But again, that's going to require, it's the distancing, and then the other side of the coin is testing.
So if a member of your household needs to continue to work, what should be done to ensure that virus is not brought home on clothes or skin? Showering and changing clothes enough?
No. Well, sort of, yes.
Down
Yes
food
and no.
packaging with disinfectant?
So first of all, as I said before, we're going to be locked down in Indiana come Wednesday. So unless you're working in a grocery store or a pharmacy or a hospital, you shouldn't be working. How do people in those industries protect themselves? So look, in a grocery store, you can probably be okay. In a pharmacy, you're probably okay. In a hospital situation where you're caring for people with this disease, I know lots of people who are self-quarantining at this point, meaning that, like, the spouse who is working in the hospital lives in the garage. Just horrible. I'm not, like, in any way saying that this is, like, good. It's terrible. Or the basement or whatever. But, like, they're isolating themselves to limit spread to the family, which is, I don't know, not sustainable, I think, even in the long run in general. So the same techniques to protect yourself that I said before: hand washing, cough into your elbow, don't go out if you're sick, don't expose yourself to sick people. Unfortunately, hospital people can't meet all those criteria. They have to expose themselves, which is why they need the equipment that people are hoarding. So not to belabor that again, but we have to do our best to, protect those people and protect each other for as long as we possibly can. But unfortunately, there's a lot of bad options, unfortunately, to choose from. There's no easy answer or silver bullet to any of this.
Part of that question was, so one goes to the supermarket or has food delivered.
Oh, so yeah,
You're
right.
How does one?
So food delivered is your best bet. As much as you can do that, do it, and tip those people incredibly well if you can. We got to keep this economy going, and for God's sake, as much as you can, refuse, but for everyone that comes into your house, refuse to let them come in your house, but still pay them again as much as you can, because we gotta support those that we can as much as possible. But your best bet is delivery. Let them leave it on the porch, because this virus is mostly person to person, and if you don't contact someone else, better take the food in, unpack it, put it away, wash your hands immediately, and that will protect you. That stuff doesn't live on surfaces forever, depending on what the surface is. Studies show 4 and 24, even plus a little more. But again, even when you take that stuff back out to make dinner, wash your hands. Take the packaging, put it down, get the food up, wash your hands, wash your hands, wash your hands. Constantly be thinking, I touched something, wash your hands. That's the best thing you can do. Stay away from other people. That's about as good as we can do.
So Aaron, I'm going to close by asking you a religious question. With the approaching holiday of Passover, where we recite the 10 plagues at the Seder, yet the story is a story of freedom and liberation, what hopeful note can you offer us as we anticipate the Festival of Redemption?
We've gone through plagues before. So great, we're good at it. As much as this is doom and gloom, we've gotten through this before. I mean, there was a pandemic in 1917, which literally killed 50 million people, and we recovered. And that was during World War I, and we recovered. And we got through World War II and we recovered. And we got through pandemics in 57 and 67, and we got through pandemics of the swine flu, and we've gone through SARS and Ebola, and this is bad. But, we as a people and as a world can recover. We got to play the long game. This is a marathon. It is not a sprint. These will be difficult. These will be hard times, but this is when community and sticking together matters. This is happening to us, not to individuals. Always. And the message of taking care of yourself with respect to viruses, I say this with vaccination all the time. You don't vaccinate to protect yourself. You vaccinate to protect others who cannot protect themselves. One of the best examples that I can give with vaccination is with the chickenpox vaccine. When we were all kids, there was no vaccine. We would get chickenpox and we would go on with our lives. But we didn't really understand that there were kids, babies, that died of chickenpox every year, because babies it can really hit them hard, and older people, but babies especially. Older people was hard to get to not be immune. When we came out with the chickenpox vaccine and we started encouraging people to do it, a lot of people said, well, why should I bother? I'm going to be fine. And the message was, you don't do it to protect yourself. You do it to protect other people. And so a couple of years after the chickenpox vaccine was starting to be administered, 0 babies died of varicella. 0 babies died of chickenpox. And for all the complaints about people not vaccinating themselves, and it wasn't that we saved 8-year-olds or the kids that we were getting, it was we saved babies who could not vaccinate themselves. All these measures we're taking, they may not be to protect ourselves. They're to protect the elderly. They're to protect the immunocompromised. They're to protect the people we love. Choking up, so I'm sorry. Who have cancer, who might be immunocompromised, who can't protect themselves. That's why we got to do this, because it's not just about whether we make it through the day or whether, we'll be okay, because most of us will be. The vast majority of people, even if we give this virus to everybody, the vast majority of people will be okay. But the millions of people who won't be are people we love, and people we care about. And we have to do this and make sacrifices to protect them and to do the right thing. And I don't know, I feel like that's Jewish, but we're a community. And it's, the Passover wasn't just about, the people that got freed. It's about all of us. And the fact that we want to be free in the future. And what happened then matters to us. what happens to what we do today to protect as many people as possible. We'll be paying it forward for all the people that we can protect, even if it's not us.
Aaron, you have said very eloquently what I tried to say in a recent interview. They asked me, as a person of faith, what message would you bring to the community at this time? And I said, the message that I would bring is that to people of faith, is that you need to follow the medical and scientific protocols, because the cure for this disease will come from the medical and scientific community. However, communities of faith can provide healing as we move along. So you have helped us tonight not only to understand better the scientific and the medical component of a hopeful cure to come, but also how we as a community can come together and, using the resources of our heritage and of our congregation and the support of one another, bring healing in times of stress and in times of worry.
And I want to say, it's like, well, we want to make a vaccine. We want to find drugs to do this. But the measures that we as people will take to distance and try to slow this outbreak will do just as much, if not more. And so the sacrifices we're willing to make matter just as much. The people in the front
the
line,
encouragement that we give one another is part of that process.
All going to make a difference.
Absolutely. So I want to thank also Jackie Goldstein and Sherry Levine and my colleagues, Rabbi Jenny Greenspan, Cantor Melissa Cohen, the staff at the congregation, and our lay leaders, Dan Fox and Todd Maurer and Dan Resnick and Cindy Harp, and everybody who has come together to help us as a congregation to course through this period. Sherry is on screen to my right there. We have been in touch virtually many times a day. So hopefully all this virtual Judaism will make us very virtuous people. But the most important thing is that we continue to stay in touch. And we have a lot of programs yet ahead. You will be receiving information about future Monday evening conversations, just like this one, that will take place every other week on Mondays. And beginning this week, we will have some programs every morning. Tuesday morning, Sing Along with Cantor Melissa, Judaism to Go with Rabbi Dennis on Wednesday, Create with Rabbi Jenny on Thursdays, Early Childhood Shabbat on Fridays, and then comes, of course, the Shabbat evening and Saturday Shabbat daytime experiences. Thank you for your help. And Amy in the back there, thank you for serving as host to this evening's conversation. Thank you all for participating and for this. Hi, Amy. Take care of him. Aaron, take care of her.
We will.
Take care of each other and the kids. Okay, love you all. Thank you for joining us tonight. We look forward to a future conversation.
Thank you.